Group.
All right, good afternoon, everyone. Welcome to our February 17, 2022 meeting of the Council on Developmental Services for the state of Connecticut. My name is Kevin Zingler. I'm the chair of the council. I believe we have a quorum present, so I believe we can start the meeting. I see Joe nodding his head. He'll be taking the minutes for us. Just a reminder that this meeting is being recorded, so there'll be a video and audio version of this meeting available under Public Act 21-2. As a reminder to council members, please state your name before speaking so that if there was an audio version, people would know how to follow along with the meeting here. So welcome again to everyone to the meeting. And if you're on the phone, *6 will unmute you. So first item on our agenda, we're going to have a moment of silence for anyone affected by COVID-19, if we may, please. Thank you. And our thoughts and prayers to anyone who is battling that disease. All right, the second item on our agenda is an opportunity for public participation. So any members of the public wish to address the council, you have 3 minutes. Please state your name before speaking. Is there any members of the public that wish to address the council at this time? Hi, I see Donna has raised her hand. Welcome, Donna.
Hi, thank you. I just wanted to quickly introduce myself. I'm Donna Cohen. I have a daughter who's 29 with a developmental disability, autism, and an intellectual disability. And I was here last month, and I thought this was an amazing group, and I thought I'd keep hopping on.
Welcome. Thank you.
Thank you.
Excellent. Any other members of the public wish to address the council at this time? All right, seeing no hands raised or anyone unmute themselves, I'll call the opportunity for public comment to be closed. And we're going to jump right into our agenda. So the first item on our agenda, or the third item, I'm sorry, is topics for discussion is, once again, this is Kevin Zingler from the council, the chair. First item is review and approval of the previous council meeting minutes of January 20th, 2022. You should have received the minutes. Is there a motion or discussion or motion to approve the minutes as presented?
So moved with corrections, Karen Levesque.
Okay, I have a motion and obviously there's some amendments to that, but is there a second to open the discussion?
Second.
Seconded by Rick Rothstein. All right, we have a motion on the table to approve the minutes and I wanted to open out for discussion. Karen, the floor is yours for any discussion.
Yes, thank you very much. I have forwarded my corrections to Mr. Carvalho earlier via email. The first of which was under the commissioner's report, under the first bullet, second sentence that says, that said individuals served made it through largely without any adverse, and I think it's missing a word.
And I added outcomes, if it pleases the council, of course.
All right, and the other correction I had was on page 2, under the bullet that starts Dr. Cheryl Ellis. The second sentence indicates after a long process of many, and I believe we might be missing a word there.
Yep, and my suggestion there, again, if it pleases the council, I defer to you all. I was just going to eliminate that fragmented sentence and just proceed. You know, Dr. Cheryl Ellis has joined DDS leadership team as DDS's new DEI director, and she will be splitting her time, so on and so forth.
Okay, that sounds fine with me.
Joe, this is Rick Lenz. Those are the two missing words that I had alluded to earlier. Karen snagged them ahead of me.
Wonderful, Rick. I appreciate that.
Any other?
And then we also,
yep, go ahead.
We also
sorry,
had
Joe.
one from, sorry, and Joe Carvalho, Executive Secretary, DDS. I did have one from Rick Rothstein. He did remind me that I had misattributed a quote to Rick Lenz, when in fact it was Rick Rothstein who had made this comment regarding Senator Austin proposing a 4 to 5% increase in wages over the next few years. So I did make that correction. And I see, And that was it for me.
Yep. Deb, I see your hand up. Go ahead. This is Kevin.
Oh, Deb, you're muted at the moment.
Sorry, this is Deborah Ullman. I'm just wondering, since we do seem to spend a great deal of time on this, many months, if there is a way that we could make it a smoother process, that maybe we talked with staff and with some of the board leadership or something, and we figure out a way so that we're not spending 10 minutes correcting typos and things like that. Just a suggestion.
Great. We will take that. This is Kevin Zingler, the chair. I will bring that back and we'll figure out a way of getting this out sooner so that folks can review them ahead of time and give feedback. Other suggestions, corrections, additions, deletions? Seeing none, all in favor of the revised minutes as amended, signify by saying aye.
Aye.
Anyone opposed? Chair, seeing none, chair votes aye and it passes unanimously. Thank you. Moving on to the next item on our agenda, the ombudsperson's report. Welcome, Shannon Giacovino, DDS ombudsman person.
Hi, everyone. This is Shannon Giacovino, the DDS ombudsperson. So I wanted to do three things today. First, I wanted to see if there were any questions or suggested edits to my report before it goes up on the website. Does anybody have any questions about anything in the report?
Shannon, Rick Lenz here.
Okay. Hi, Rick.
Hi, I just wondered if the numbers that are in parentheses, what do they indicate?
Shannon, I temporarily muted you because I was getting some feedback. I apologize.
That's okay. This is Shannon Giacovino, the DDS ombudsperson. Last month, the council had asked me to indicate, if I could, the number of times I had dealt with a specific issue. And so the number at the end of the sentence indicates an approximation of the number of times a certain issue might have come up.
Okay, great. Thank you.
You're welcome.
Any other feedback? I see Patty, you have your hand raised.
Yeah, so if anybody's reading that and isn't aware of that request that those numbers be put in there, maybe just some notation that just, stays permanently, on the, document. So if somebody's looking it up on the website, they'll know what those numbers correspond to.
This is Shannon Giacovino, the DDS ombudsperson. That's a great suggestion. I'll add that to this report and on the reports going forward. It's sometimes difficult for me to be able to do that. And I also, one of the things I want to point out is that, I know that in Ed's report, and in a lot of my reports, you're going to see references to case management. And my concern is that I don't want people to think that every time I hear about something or every time I deal with a case manager or a certain region or whatever, that indicates that there's problems. Sometimes in the course of my job, I just need to be able to work with people at the agency. And so that was one of the reasons why I didn't put numbers on things before, because I didn't want people to think, oh, here is another 10 problems with case managers. There are problems sometimes, but a lot of times my report just indicates that those are the people that I'm working with to resolve an issue.
And then the only other suggestion would be to add page numbers.
All right.
Did
Any
anybody-
other? Yep, go ahead, Shannon. Sorry.
Okay. Did anybody have any, this is Shannon Giacomino, I'm ombudsperson. Does anybody have any questions about anything specific about the assistance that was provided for families or any of the meetings or visits that I've done?
Shannon, this is Nick Rothstein. I was wondering whether you were visiting private sector group homes as well as the public sector ones?
This is Shannon Giacovino, the ombudsperson. I have not done that yet, Rick. But I think it's a good suggestion. It's been a difficult time in the past month or so to be able to do that because of the COVID surge. But that's a great suggestion. And if anybody on the council receives services somewhere, or if they want to connect me with a provider that they'd like me to meet with, then please let me know. But I will do that. I'll start to reach out myself too. Thank you.
This is Kevin Zingler. I see Karen, Rick, are you done? I'm sorry. Yeah, okay. I see Karen Havlicek has her hand up.
Yes, thank you. I do want to agree with the areas of concern that you have listed in your report, because these are the things that I'm hearing in the wider population are concerns. Definitely the staffing crisis is a big concern in both public and private sectors. And, perhaps I'm hoping that the commissioner can address that later on in his report, because that is, people are very, very concerned about having adequate staffing for provision of service for their persons that are being cared for. So I'm glad that you're illuminating that in your report.
This is Shannon Giacovino, the DDS ombudsperson. Thanks for raising that, Karen, because I was hoping that maybe the council might want to have a discussion about that and about what action the council wants to take to highlight that issue and to address that issue, especially now that the legislature is in session. I was hoping that there might be some discussion about the council taking action to highlight the issue.
I see Patty has her hand raised.
I don't know how to raise my little pretend hand.
Oh, I'm sorry. I
I have
didn't
my
see you.
actual hand up. I can't get my pretend hand to work. Just about the case manager issue. I'm sure many people have heard me say, I have the best case manager. And why do I say that? Because she calls me back. And when I talk to her about something, she says, I'm going to work on it. And then she'll call me back and tell me what she found out. It doesn't always mean I get what I want, but she's responsive. And when I tell I'm in touch with a lot of families. Many families are not finding their case managers very responsive. And I don't know if it's 10%. I have no idea how to aggregate it, but I think we need to know, and certainly the staff of the DDS needs to know. So interacting with the case manager to solve a problem is different from a parent complaining the case manager is not responsive. So maybe you could sort of figure out how to highlight that issue, or the case manager doesn't seem to care, or whatever. But they're really, everywhere in the world, there's really good employees, and there's sort of like, and we need to know, because families are getting very, very frustrated.
This is Shannon, the DDS ombudsperson. I have to say, honestly, and I know what you're saying, Adrian, I've heard that myself. However, in my current role, I've really only gotten one complaint about a case manager not getting back to someone. People so far have not called me with that specific complaint. So most of what you would see in my report up until now has been me working with the case management supervisors and the case managers to address the issues that people have. And like I said last month, people have been very responsive and very thorough in their response.
Great. This is Kevin Zingler, Chair of the Council. I saw Patty had her hand up. Patty, you're at the floor.
Patty Silva. I did catch one typo, Shannon. It was probably an autocorrect. Number 2 for an individual who broke his foot.
This is Shannon. I saw that one too, so I'll take that out. Thank you.
Yep.
Any other questions? This is Kevin Ziegler, Chair of the Council. Any other questions or concerns of the ombudsperson's report submitted? I don't see anyone else. If anyone's on the phone, *6 to unmute yourself. All right, hearing no further comments from the council. Thank you, Shannon, for your report. Is there anything else you wanted to let the council know about? Or
Yes, this is Shannon, ombudsperson again. My nomination hearing is next Thursday from 10 to I'm not sure when. So I don't know. I'm asking all of you to submit testimony to support my nomination. I don't know if the council would prefer to do it in one letter, or if you prefer to do it individually. If you want to do it individually, then I'd be happy to share the information with everybody on how you can do that.
Great, thank you. This is Kevin Ziegler, Chair of the Council. Joe, why don't you, or Shannon, why don't you send us the information via Joe, and then we can have the council individually do letters, or we can take a brief moment under our legislative update to discuss how we want to handle that in terms of maybe the council putting together a letter.
Great, this is Shannon. Thank you.
You're welcome.
Kevin,
All
very
right.
quickly, I apologize for interrupting. This is Joe Carvalho, Executive Secretary, DDS. In me shuffling around some documents on my computer, I did miss who made the motion to approve and who seconded the amendments to the last month's minutes. I apologize. I didn't catch that. I just want to ensure I get that recorded.
So my recollection has it as Karen made the motion, and it was seconded by Rick Rothstein.
Thank you so much. I apologize for interrupting.
Okay, perfect. All right, moving on the agenda, we're going to move on to the Commissioner's report. Commissioner Shelf, welcome to the meeting. Thank you for joining us.
Jordan Sheff, Commissioner DDS. First, I just want to note, Donna popped a question or a statement in the chat. And Donna, just as and Rod's not here to do Robert's Rules of Order, typically, if you have questions you want answered or things, we ask you to do that in your opening few minutes that we give you as a member of the public. But I think that if you'd like to learn more about what the ombudsman does and the ombudsperson does and their role, that I'm sure Shannon would be happy to reach out and connect with you directly on that. It's what she does. So I'll make sure that we have a way to connect you both. And she can tell you a whole lot, even though she's relatively new inside the organization. She's been with us, part of the DDS family and extended family for a long time. So my report. First, I want to just remind folks that Kevin Bronson is joining us, but had another commitment and won't be on until 5 or maybe a little after. So we can go look to him for some of the legislative things that I don't cover with you. And I'll try not to cover too much so that when he comes in, he's not repeating what I've already said. So first, a COVID update. We have had an incident command activated around COVID-19. It's a formal FEMA structure that we have maintained our cadence at different frequencies, but there were times where we met daily in the beginning, and then in the second winter surge, a couple times a week during Omicron before settling down to weekly and now bi-weekly. Today is the first day I can remember hearing some of the things I've heard in far too long. The North region reported no new COVID cases in a 2-week span. Southbury has 1 person recovering in isolation and will soon be COVID-free and reopening all of their supports and services and reintroducing people to day programs in the coming days. Crest reports that in the rest of public, we are currently COVID-free at the individual supported level. We're down to only having 60 staff out on COVID leave. We had been in the hundreds. So that's a much better place to be, hundreds and hundreds. And I think between the West and the South region, there was a total of about 5 new cases reported in the last 2 weeks. Those are tremendous things to hear for me. And that allows me to segue to a conversation that's come up regarding respite. when Omicron was really coming on strong, I made the decision because we didn't have adequate testing supplies. We didn't have any testing supplies available at the respite centers to shut them down till we could fortify them with supplies and redeploy the staff to other places. We are reopening not this weekend, but next weekend. So the last weekend of February, it was shuttered longer than I'd hoped. But it was also helpful in that we had isolation and quarantine spaces made available in that manner, and we had the benefit of additional staff. But those, and I do not believe we will be in that position again going forward, where we have to shutter respite, because now we have everything we would need to accommodate people with testing and proper PPE distributed to all 10 of the respite centers. I want to talk just briefly about the budget. My testimony will be submitted in written fashion. The Appropriations Committee has asked that we do a very brief intro. I believe there's bonus dollars to anybody who can keep it under a minute before they ask questions. I'm going to try and really get a lot of money and keep it under 30 seconds. So if you're tuning in to hear me talk, provide testimony next week, I believe it's next Thursday. Joe can share the time in the chat. I'll be answering a lot of questions, and whether or not they're about the budget depends on who's asking them and what where they're at in the session. But the budget overall was good to DDS. The governor's budget is always good to DDS, but particularly good this year in terms of there were no cuts. The only reductions you'll see have to do with HR and IT centralization, so money leaving DDS to go to DAS to pay for the services we get around human resources and IT. There were a few small adds, and so we're very happy to have some money in the governor's budget to distribute to both public and private camps, which have historically not gotten funding other than through fundraising. They serve a valuable purpose in terms of getting people back out and socially integrated and doing things this summer. We have some money we'll be able to invest. How we apportion that $5 million is still not clear, but we're happy to have it. It'll definitely be used across both public and private. The wage money, when you look at the budget, it's robust. You'll see additions to both our day services line and our res line, which is housed at inside the DSS budget. Those numbers are large and still don't reflect the millions of dollars that the secretary afforded us through the wage package from last June. So we're in pretty good shape. In addition to that, you'll see some monies around the ARPA and the FMAP. We're still working through with OPM, with CMS, with the legislature. We had a hearing, an informal hearing on our Appendix K. There's a formal, our Appendix K to the waiver amendment. There's a formal hearing on that. I believe as of 5 o'clock, the comment period ends today. And as of yet, we've received no public comment. So it should be a pretty brief hearing, because typically with no public comment, there may be a few comments from the legislators, but not a lot of public testimony, which is fine. It's good for providers. It's good for people we support. It's good for the agency. Most of the money ends up in the private sector, with a small amount of money left to DDS for administrative support to get that money out the door and to make sure it functions in the way that it should. Legislatively, there's not a lot that we are offering. I think there are 5 proposals we met with public health. They will look to consolidate those. I think the only there's ones about DSS asked us to put forward, I believe, disregarding certain benefits, disregarding ABLE accounts for qualifying for TANF and another subsidy program. so that people aren't disqualified from other benefits just because they've opened an ABLE account. Kevin, you're 3 minutes early. I would have left this all for you, but welcome. And one about the Family Support Council, but I'll let Kevin run through that now that I know he's here, and I'll let you do your ledge report in a moment. A few more things I wanted to touch base on. The retirement cliff. We are about 6 weeks away from April 1st. There are people adding their names to the April 1st retirement list on a weekly basis. And it's a little nerve-wracking, to say the least. We are preparing for the exodus of all sorts of people. For me personally or professionally, there's some key people that will be leaving April 1st. We will be revealing or sharing out what our coverage plan will be for that in the weeks to come. And because of the amount of people retiring, where I have appointing authority, in the past, we've sometimes done a competitive process, and sometimes we've just appointed an internal or external candidate we thought best fit for the job. Because so many people are leaving at once and we need some stability, we'll be using a mix of both my appointing authority as well as competitive process for some of the appointed jobs. All the classified jobs have to go through a competitive process. Also to ensure that we're able to maintain our continuous operations, we'll be utilizing the temporary worker retiree. We call them TWRs. A lot of people who will retire on April 1st will ask to come back until we can fill their prior seat. They come back typically on a 2 to 3 day a week basis after taking a 1 week break from service. We won't do that for everyone who's retiring for a couple of reasons. Not everyone wants to, and not every position is, in terms of continuous operations, is critical for that. So or for support of the administration. So there'll be a mix of when and where we do that. And then I talked a little bit last month about providers needing some sort of relief in the delicate space we'd be operating in, and trying to figure out how we give them space because of this workforce crisis, which I'll touch on again a little further down the line. We did issue some guidance around licensing and QSRs. I think that went out today, and some non-critical training extensions that we can do, 45 and 90-day windows on certain training expirations to give providers a little bit more time. We're meeting with the providers on the med admin issue. As some of you are well aware, while providers have nurses with delegating authority for medication administration, the certification program is run through the state. And we'll be meeting with them about what we can do to assist in making that less burdensome, while still making sure that it's comprehensive, because the nurses have to delegate medication dispensing to non-certified, unlicensed DSW professionals. So that's the way it's always been, that we call them CUP, certified unlicensed professionals. So the direct care staff in private and public group homes are not licensed, but they are certified to pass meds under a nurse's delegation. And we're just making sure that we have all our ducks in a row and can make sure we do that in a way that will help both providers and maintain the safety for those living in the homes, and how we do that. So we have come up with some ways. I'm sure, given the level of the crisis, it's a drop in the bucket. A group called Aaidd, American Association for Intellectual and Developmental Disabilities, published a report or shared a report at a conference just recently. It was noteworthy. It goes back to some of the conversation we've had about pay and the workforce crisis, and what's important about filling these roles in our service system. I don't know that you'll take much solace in this for those of you who are hearing on a daily basis about the workforce crisis, but our level of vacancy in Connecticut in our provider for our providers is below the national average. We're not doing as worst as most. Right? You all feel warm and fuzzy about your loved ones now, I'm sure. And we pay the highest starting direct care wage in the nation at present, or will on July 1st when we move to 1725. And not necessarily the highest cost of living. So the money argument, while certainly providers, staff would welcome additional resources, and the ARPA funding will give us some of that, the American Relief Act. There are other things we need to figure out and how we do that. And it was interesting you asked Shannon about it, and because it was in a report. She and I did have a conversation specifically about it the other day, because both of us have been around the business longer than we'd like to admit, and neither of us has ever seen it quite like this, or even close, to be quite frank. The governors, we're looking potentially with the whether through the ARPA funding or through existing appropriations. I'm trying to figure out the best way to position an embedded person in DDS whose specific responsibilities would be to work with providers on workforce development within our industry as an adjunct to the governor's Workforce Development Council, which is doing a large amount of work, but and in the healthcare sector, but not always able to where we fit in the slice of the pie, given all the needs across all the industries that are begging for workers and workforce development. We don't have a person who we can full-time dedicate to it currently, particularly with April 1st looming. So we're looking to position ourselves, and I think that will be a multi-year position, 2 to 3 years, hopefully, because I don't see a rapid end to the crisis. I don't see I was told when the $2,000 per family ran out, that would solve the workforce crisis. And then when I was told when the extended unemployment benefit ran out, that would solve the crisis. I was told when transmission rates got lower again, that would solve the workforce crisis. When we upskilled people to other sectors outside of what we do, there'd be a vacuum created, and that would solve the workforce crisis. And as you all know, we haven't yet in our sector solved the workforce crisis. So we'll be looking to do quite a bit of that. And then lastly, I appreciated Adrian's comment about the case management and the bell, referencing sort of what I refer to as the bell curve distribution. You have some super performers, you have some underperformers, and you have your middle section. And depending on how you stretch out that bell curve as to where that all lies. We are in an extraordinary time of transition with a bunch of people retiring. We are as close to fully staffed in case management as we've been in some time, but that will get worse again on March 1st and then on April 1st. But we now have a number of people in the queue and are putting forward positions both in direct operations, so throughout public, as well as in case management, prioritizing those. And I have gained some latitude with the administration to overshoot on my request for case managers because we haven't been fully staffed, literally fully staffed. We haven't had every position filled in my 10 years at DDS. We've always had some number of vacancies. So I'm going to use a rough figure. I know it's being recorded, so for those of you who are watching this later, don't hold me to the math. But let's say that 350 would be fully staffed. I'm hoping to position us to have 360 or 370 positions because we run 10 to 15 short at all time. And that way we're never really short in what is what we all know is integral for both families, providers, and people receiving our supports and services is that case management role. What you've seen over the last 2 years with the number of vacancies we have is case management supervisors who ought to be supervising case managers, taking on caseloads, sometimes 2, sometimes 2.5, in a rare instance 3 or so. As we brought on some more staff, that has alleviated some. But it takes a while, especially with the varying degrees and varying numbers of caseloads, somewhere between 35 and 60, depending on the type of caseload you may have. And we talk often with our partners at 1199 about ways to make that work better. So I'm going to come up for air there. Oh, just a couple quick other things. The council had asked potentially for a report out on Aaidd partnership. I did touch base with Katie. With everything else going on, we were not able to get coordinated and rebooted on Aaidd partnership this month. We will try to get her here in March, I think is what the email said, but it wasn't a forgotten request. We just weren't able to respond to it. And then Dr. Ellis, I believe, has also agreed to join us in March to talk about diversity, equity, and inclusion work that she's looking to do for the agency. And I'll pause and come up for air there, and take another glug of water, and see if you have any questions.
Commissioner Rick Lenz, you mentioned March 1st as well as April as a critical date for case management numbers. What's happening March 1st?
Most people retire from state service on the 1st of any given month. So the largest number is April 1st, and I'm too far away from retirement to really fully get into the granular level of why April 1st, October 1st, and July 1st tend to be the most popular dates for retirement. But we have some people who I know will be losing on March 1st ahead of the April exodus. April's the big number, but we have people retire the 1st of every month year round. We haven't had a month without a retirement in a while.
Is the number for April unusually high this year?
Yes, and we can get that to the council. It's a big number, and I forget exactly what it is. I think all told, by the time July comes, from July 1 to July 1, it's in the hundreds of people who will have retired in the fiscal year, hundreds and hundreds. I think the number for off the top of my head, I looked it up this morning, and I swear I ought to be able to remember it. It was maybe 60 to 80 people, maybe more. I don't have it in front of me. I'm sorry.
Okay, thank you.
Adrian, I see your real hand up.
Am I unmuted? Yes, okay. Two things. One is, well, first of all, it's good to see you. Thank you for this comprehensive picture here. I haven't read the governor's budget, honestly, but I have read the letter from the ARC that I just got saying, please call the Appropriations Committee and tell them we need more funding for direct service providers. So I'm confused between what you're saying, that there's a big, robust increase, and yet this letter from the ARC saying, help us, we really have problems. I also drove.
Go ahead.
I drove by a McDonald's the other day, and I almost went off the road, which of course is an exaggeration, because they're offering people $18 an hour at McDonald's. You know, I thought they were $8 an hour, but anyway. So 17, whatever it is, 25. It's certainly better than when it used to be 10 and 12, but anyway, what's the story with the pay?
So so I haven't I usually get the ARC letters. I haven't seen that ARC letter. It may have come in the gap while I was getting ready for tonight. The money as it's come in has been over the last several years, going back to Secretary Barnes's $14.50 an hour, which seems forever ago, but it's less than 4 years ago, has been targeted specifically to wages. And at the time that Secretary Barnes and Governor Malloy, and later Secretary McCaw and Governor Lamont authorized very large increases to our funding, we weren't facing, it was not the situation we're in now. Those numbers looked really robust. And so, but as you're aware, with some of the workforce crisis going on across the country and all across Connecticut and across all industries, yeah, I think I've shared this before. I was just recently in Pennsylvania. There's like a Gas and Go, or a Dairy Mart, or a Cumberland Farms type of establishment, a Henny Penny, I think they are there, whatever they are. $20 an hour for daytime shifts, $25 an hour for overnight shifts, and currently they are not open at night. This is in rural Pennsylvania. They're not open 24 hours right now because they can't get people to work for $25 an hour at a cash register at a gas station. So when I say that it's as bad as it is here, it's bad in other places. It's bad. We're competing with, quite frankly, with Amazon, with Target, with Aldi's, but with mom and pop shops too are having to pay more for wages. So there's an extraordinary amount of money in our budget on a per person basis when we look at ourselves across the country and when we look at ourselves regionally. That is not to say that more money, that providers wouldn't want more money to try and alleviate the workforce crisis. But I've said a couple times now, I think societally, economically, in a larger scale, there has to be a pivot. And this is less Commissioner Chef and more Jordan Chef, the guy who gets bored at night and reads articles in economy stuff and philosophy stuff. I think there's going to have to be a pivot where we pay, where we as a culture, as a society, determine that people who have to show up to a place to work need a premium over those of us who are able to telework. And those of us who are able to telework are going to have to take a discount. We're driving less, we can cook at home. Like, I think to rebalance within existing resources, there has to be a way that we can reward people who are willing to go on the front lines and do that essential work out of their house, requiring them to have a vehicle, being away from their families, and doing all those things. I think that has to start to look different. And I think they have to feel valued for the work that they do, and they have to be recognized as a profession, and not not charitable work or work anybody can do. Just stop by and help with an art project on a Saturday and you've done God's work. I think that it's critical work. I think it's skilled work. It needs to be recognized as such, and it needs to be compensated as such. But there is the secretary, with our budget around 1.1 billion, lifted us up almost 20% in a year with $185 million added to our budget when she did that last June. That's a lot of money to throw into one system. And my sister agencies will tell you they got the short end of the stick, where they got 2 or 3%, and we saw nearly a 20% increase. That doesn't mean that the providers won't ask or shouldn't ask for additional resources. So maybe perhaps within all of that cigar smoke I just blew, you'll find the answer to the disparity between the ARC's letter and how I opened my statement.
Retirement question, quick. The people that are retiring from the state, are they mostly direct service providers or more at the administrative level, or do you have sort of a breakdown of that?
So there are certainly a number of direct service workers and frontline staff, other positions in public, and some of you on the call will know the difference between these, but SDSWs and PSs, we're losing. So program supervisors, SDSWs would be sort of like lead, and I may have this wrong, so if my staff are listening and I screw this up, I apologize. Lead staff and group home manager equivalents. We just have other codes for them in public, SDSWs and PS. Some PSs oversee more than one group home, and then we have program managers. But we're losing them both in the public service system, and we're losing them in respite, we're losing them in IFS, managers, supervisors, case managers, brokers, people in our fiscal office, and we're losing we're losing people in leadership roles. Not that the other positions I just mentioned don't lead in a variety of ways, but at the higher levels of the organization. So I think it's public fodder now that my deputy commissioner's leaving April 1st. And so, that's an example of how high up the chain this impacts. We'll be losing at least one ARD, assistant regional director, and at some point in the next year, losing one of our regional directors. So to retirement. And that cascades, there's a fewer number of those higher level positions. So the numbers look smaller at that rank than at the direct support level. We do have at the direct support level and other related positions, nursing, those SDSWs, those PS. I think we have some 500 or so positions underway for refilling there. And I've made those a priority over the management positions and other essential function positions, because we need to be able to maintain safety. You know, the staffing got so bad during Omicron that we were forced to consider consolidation of homes and programs that would be contraindicated when you're trying to keep people safe from COVID. To jam more people together is not a good idea, but you need staff and nurses to support them. The nursing crisis is ridiculous. You know, those of you on the call aligned with private providers know how desperate it is out there. Dr. Val Bagby-Young, who you've met, or many of you have met, indicated to me that in some hospitals right now, they are offering nurses salary plus $30 or $40 or $50 an hour on top of that as a retention bonus during the remainder of the pandemic, just to get them in. We're not going to compete with that.
This is Kevin Zingler. I see Karen, you have your hand up?
Yes, I do. Karen Levesque, I have a question. Could you share with us, if you know, what the census is now at STS?
The 133 or 132? That's a ballpark. It's between 130 and 135. We lost another member of our family at STS last week, and I can't remember the count off the top of my head.
I agree. Are we having a large group of individuals that are in state service retiring at that location, to your knowledge?
We have, yes, but I don't think it's disproportionately. I think there are other areas of public that are getting hit harder than STS. So for Donna's benefit, Southbury Training School.
Oh, sorry.
That's okay. We have guests tonight, so I have to not always speak in acronyms, and she's not allowed to yell at me when I do.
Yes. And speaking of nursing shortage, while I was on here, I just got contacted again by a recruiter. So
they're begging. The recruiters are out there. There is a movement afoot to bring people out of retirement, and I'm talking. And I believe there's a program, or there was. I don't know if it still existed. DPH for people who had retired and let their nursing license expire to get it reinstated on a rapid basis. That's how desperate the situation is for clinical staff.
Thank you for that information.
This is Kevin Zingler, Chair of the Council. Any other further comments for the Commissioner's report?
Kevin, this is Kevin Bronson. Commissioner, I have the numbers if you want me to read them.
What numbers?
The retirement numbers.
Oh, okay. Great.
The lotto for everyone.
I just didn't know which numbers. Yeah, sure. If you have them, that'd be great, Kevin. Thank you.
Yeah. So the numbers for this fiscal year, which they're figures that payrolls received, and these are just self-identified retirements. So there could be more, or there can't be less, but there could be more. So the month of March, 26. The month of April, 88. May, 16. In June, 25. So as you could see, there is that spike in April, like the Commissioner was saying.
What was March?
26.
26. 26, 88, 16, 25.
And no one yelled bingo, which is disheartening. There are also some numbers back January 1st, December 1st. I mean, we've been attriting, losing people all year. So it should settle down a little bit after that. It's also important to note, reflected in the numbers, and those were the numbers I was looking at this morning, Kevin, I couldn't find now, that some of those retirements, most of those retirements are going to be true losses to the department. Some of those people are people who separated from service at some point prior, but aren't eligible for retirement until now. So they're not drawing down their retirement until April 1st, but they're no longer employed. They're not an active staff person for the state right now, but they leave their vested pension with us and come back to draw it down when they meet the age requirement. but it's a small number. I think when I went through that roster, there was 15 or 20 out of the hundreds that were going that might fit that bill.
All right, any other, this is Kevin Ziegler, Chair of the Council. Is there any other questions for the Commissioner? All right.
Thank you, everybody. I'll remain on the call and, if you need me for anything else.
Great, thank you, Commissioner. All right, moving on. Next item on our agenda is our legislative session update. So Kevin Bronson, Director of Legislative Affairs for DDS, is here. So I think, Kevin, I think we wanted to just get an update from the councils, or from your perspective, of how the council can help. We know that there's appropriations hearing next week. We also know that there is obviously the session began on February 9th. I guess we just wanted to know, we understand that there's a short list of bills that DDS is tracking that has put in for consideration by the legislature, but any highlights or things that we need to be aware of as a council?
Sure. Kevin Bronson, DDS. So as of right now, as of this very moment, we have legislative proposals there's no bills yet. The commissioner, myself, and a few others met with the chairs and ranking members of the Public Health Committee this week. Everything's combining into one, it seems like. We met, we reviewed our legislative proposals. I'm happy to quickly touch base on them if you want. And I think I've mentioned them a couple of times, but I'm happy to review. But hopefully out of that meeting, we'll find out sooner rather than later what bills they might put forward for our agency. I'm hoping we'll get at least one, which is at least our technical change bill, which didn't seem like there was too many questions, issues, concerns about it. Let's see. There's the appropriations. I believe, I'm assuming I missed the beginning, but I believe the commissioner probably touched on our budget. We have an agency budget presentation next week with the public, and that's next Thursday. I don't have a calendar in front of me, but I believe it's the 24th in the morning. And then there's a public hearing afterwards where members of the public can testify in support or against our agency's the governor's proposed budget adjustments. There's also, I don't know if it was mentioned either, but and I don't have the date, but I can circulate, or Shannon knows that Shannon's confirmation, the DDS ombudsperson's confirmation hearing is coming up, and just be aware of that. Shannon, well, we can figure that out. If she hasn't said it yet, next Thursday. Oh, again,
she did.
So everything's on Thursday. And let's see what else. I'm looking at the list that was given to me. Legislative breakfast. Or am I skipping too far?
No, this is Kevin Ziegler, Chair of the Council. We can wrap that in if the council wants, and then we can circle back for questions, because it sort of wraps together with, we understand that so far everything is going to be done virtually at this point, or a good portion of the session is going to be virtual initially anyway. So I guess our thoughts, or we're looking for your guidance and expertise in terms of, we may not be able to do a legislative breakfast like we used to do in the Capitol, if you will, but maybe allocating some time or a special meeting of the council in the future to host our leadership team from the Senate, in terms of the ranking members in the Senate. So we, as the council knows, and for the public that's watching this, we last year hosted a Representative Candelora and also Representative Rojas from the House side. So we as a council thought it would be fair and also on balance to invite the Senate side to get both sides at both chambers perspectives on DDS and the budget process. So So I
Yeah.
think that's what we're angling for at this point, instead of some kind of formal gathering where we're having a breakfast, having awards. We would do something virtually at some point to have a special meeting of the council pending their schedules and the council schedule, or dedicate an upcoming meeting to that particular topic and have them at our meeting. So. Sorry, I just did what you were going to do, Kevin. Sorry.
No, I don't know if you want to call in the commissioner.
Oh, yes.
So I'm not sure if my camera's working right now or not. I'm right next to the Wi-Fi thingy, but Jordan Chef, Commissioner at DDS. I was rambling in an attempt to make a point and never made it. And I just wanted to go back to one of the comments around the budget and what the secretary and the administration has done infusing a lot of money. And I again haven't read the ARC letter. Because of the very targeted investment in direct care, the providers have not had the kind of relief or support or resources they need for non-staff related issues, and in a time of inflation. So fuel, electricity, building, vehicles. I think that may be, and I don't want to speak for the ARC, but that may be adding to the pressure for additional resources beyond what the secretary has already generously provided and infused into the direct care staff part of it. It just gets more complicated with the workforce crisis, because if there is money left to move around, and if the administration was interested in supporting further the department, picking and choosing whether you'd put that towards wages to lessen the impact of the workforce crisis, or the many other places that our partners in the private sector will articulate well next Thursday afternoon during their portion of testimony. I'm sure that you'll hear from some familiar faces, as we have a vocal crowd of advocates as executive directors. Thanks for letting me wrap that up.
This is Kevin Zingler, Chair of the Council. Is there any other, or I'm sorry, Kevin, you had the floor. Sorry.
Yeah, no problem. Kevin Bronson. So yeah, I guess just to wrap the portion up, I'm happy to help with whatever the council would like. At least making the introductions to the Aaids, or coordinating that sort of meet and greet, or not meet and greet, but meeting. It's what I've been hearing just on the back end of stuff is that they're kind of taking it seems month to month when it comes to how much they're going to open legislative session. I could confidently tell you that they're not rolling anything back. So they haven't closed the building yet to members. They haven't closed the building to members of the public. Members of the public can still come in and come out on the first floor. But for the most part, public hearings are going to be virtual until we hear otherwise. And most people find, what they're saying is most people are finding that it's getting people testifying that have never testified before because of the convenience of it. So, and then the one last thing I forgot to say on the legislative update side is that even though we don't have any bills yet, I don't have anything to share with you really. But once I do, Rod or myself comes across one of our bills or something that's related enough to us, I'll happily share that with the council. But there just we're still at the beginning stages of it. I believe at least for public health, the raised bill deadline is next Friday. So we should see something between now and next Friday. That's when all the bills will come out, basically. And then public hearings will start after that. But I'm happy to answer any questions that the council may have.
This is Kevin Zingler, Chair of the Council. Is there any questions from council members? Please raise your hand or unmute yourself. All right. Adrian, is that a hand raise or? Okay.
Yeah, current hand raise.
I didn't know if you were looking for the mute button, so.
I think I figured that out. Adrian Benjamin, I have not introduced myself yet. Sorry, but I will now. I would just suggest that the council as a whole vote to send one letter from the council endorsing Shannon for the job rather than have each of us scramble around. And this way we'll be sure it gets done. And given that we have the letter we wrote just recently explaining her strengths and why we thought she should be the ombudsman, I would just think that would be not that hard for someone who wrote that letter to do. and for the, you know, from the council. That's just that's my proposal, suggestion, whatever. That's it.
Okay. This is Kevin Ziegler, Chair of the Council. So I guess we have a couple of issues for legislative discussion at this point. So Adrian has brought up the fact that we as a council should submit a letter of endorsement, recommendation, testimony on behalf of the council to endorse Shannon Jacobino as our DDS ombudsperson. As you know, we did draft a letter to the governor, and that's how the governor got a hold of Shannon to interview her for the position. So further discussion on that, or do we want to use, is there consensus that we should use the base of that letter and update it and submit it on behalf of the council? I'd be happy to do that on behalf of the council.
Great idea.
Okay, I see a couple hands. I see first one I see in my window here is Christine.
Hi. Yes, Christine Hainsworth-Strauss. I'm wondering, yes, I wanted to ask about Shannon's endorsement. I think we should just go ahead, and if you would like a motion, we can do that. My second point was perhaps to Kevin Bronson. One of the things that I think we have been very good at achieving in the last few years prior to COVID was showing the face of our population that we represent to the legislature. I don't know if there's some creative way to do that through photos, through messages from the various ARCs. I don't know how to do that to maybe bring our population in a visual perspective to the legislature so they remember that we exist.
Hi, this is Jordan. If I can help with that, very impactful has been some of the things that one of our friends has done. I don't know if any of you have seen Kate Halland and her son Chris provide testimony. Chris doesn't have a voice, and so it's usually a video montage. And I think that there are ways to do that well in testimony, whether you're providing written testimony with pictures and captions, or whether you are testifying during, through the Zoom call. I'm not sure how that process works and how you might share that. But you can also, in addition to providing just oral testimony, Kevin can share the email distribution list, although I think it's pretty easy to access through the General Assembly's website, where you can email all those things to legislators, and I would recommend copying Aaids. They are very impactful. I think all of you who have brought family members down to the LOB have recognized that greeting you and your loved one in person makes a great impression. So that would just be some of my suggestion. I'm sure Kevin and Shannon have other ideas as well, but I wanted to throw that out there. And I don't know why my camera has stopped working.
Kevin Bronson, Commissioner, it does work.
Really?
Yes. And we're
Okay.
recorded, so
Great.
No, so I was gonna just to tag on to what he said, we're the days of packing the second floor with 1,000 people, in support of a bill is probably no longer, but I could be wrong. So, there's as he said, the commissioner said there's plenty of other ways to do it. I'm happy to help with any means that you are looking for, but the one thing and I'm not sure how DDS has handled this in the past, but we can't really advocate for our own bill unless I'm wrong, Commissioner, but we can be in support of it, but we're not supposed to be pulling people in to testify for it. That's the work of the advocacy organizations and in the council and in Shannon's role and that sort of stuff. But I mean, correct me if I'm wrong, Commissioner.
No, whether you're in, I think that the governor and administration thinks everybody should have a voice in government. Whether you're testifying for or against the governor's budget, for or against bills, my comment was just in terms of responding to Christine. Was it Christine? So the impact of having people with intellectual disability present during testimony, and so that they can put a face with an experience that parents are describing. So not whether you're in favor or against, just other alternative ways than being in the building to let people with intellectual disability be seen during testimony was for or against is all I was suggesting. I didn't mean to suggest that we pack the place and be it for or against anything, just how you might get their faces present. Did I miss something?
No, it's Kevin Bronson. No, that's not what I meant. I just meant that I think the ARC, I believe, like, for example, I think the ARC is going to have an advocacy day, like a virtual advocacy day, if I believe that's what they mentioned, but little stuff like that. I'm happy to help find those and connect people with that, I guess is where I'm going with this, but
yeah.
So
yeah, from a public hearing perspective, as you said, packing the place with 1,000 people, just historically, up until the pandemic, between DEMIS, Veterans Affairs, and DDS, we had 2 rooms packed from 2 o'clock until, I think the latest I was there was probably 12:30 a.m., maybe 1, but most years was fortunately out by 11. And we literally numbered testifiers into the hundreds across those 3, across that night. So I think that's what the folks on the council were trying to figure out, how we do that during virtual times. Is that correct? Was that Christine who asked the question?
It was.
Yes, Christine. Yes, it was. And I guess it wasn't so much just in favor or not in favor of something, but just to let people know we exist to the population. I think, out of sight, out of mind. And I think that we have, although they've been budgetarily generous, I think it's just a helpful reminder of what's going on.
All right. This is Kevin Zingler, Chair of the Council. I see a couple hands raised. I see, Shannon, did you want to add on to that before we move on to other council members?
Yeah, this is Shannon Giacovino, the ombudsperson. I mean, I would recommend, if anybody plans to testify, if you can have your loved one there, right there with you when you're testifying. I know that, several people have done that in the past, or you've brought pictures and, so I'm happy to talk offline with people on creative ways, but I think it is very possible. And in addition to that, if you have a loved one who can testify themselves, I would encourage you to have them do that. It's important for them to hear from families and from individuals and from providers. So I'm happy to talk offline with anybody about creative ways to do that. But, those are just a couple of ideas.
Great. Kevin Zingler from the Chair of the Council. I'll call upon Patty Sylvia. Have your hand raised, Patty.
Hi, Patty Silva. Did we finish the conversation about the letter for Shannon's nomination? Do we need to do a motion on that or anything?
I thought there was consensus, but if
Okay.
the council would like to make a motion, I'd be happy to entertain one as the chair.
Okay. I would make a motion to draft a letter based on the letter that went to the governor in support of Shannon. And also, too, if anybody wanted to send one along on their own as a personal letter, obviously we do that as well.
Okay. I hear there's a motion that has been, well, there's a motion on the floor. Is there a second to that motion from the council?
Second.
Seconded by Rick Lenz. All right. So there is a formal motion on the floor to draft a letter on behalf of the council using the template or using the original letter that was sent to the governor upon the selection and recommendation of Shannon Giacomino as ombudsperson. Is there any further discussion on this motion? Seeing none, all in favor, signify by saying aye.
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 Anyone opposed? Seeing none, chair votes aye and it passes unanimously. So I will draft that up and I'll circulate amongst the council members and we will submit it as testimony for next Thursday.
Thank you, Kevin.
Oh, thank you. All right, is there any, did you have anything else on the legislative or is that what, okay. Moving on, I have another hand up. This is Kevin Zingler, chair of the council. I have Rick Rothstein's hand up. Rick.
Kevin, since we're talking about next Thursday in the Appropriations Committee hearing, in past years, we have submitted testimony to support the governor's budget and the department. So just wondering if we want to do that or not again.
Okay, there has been a suggestion and on the floor, this is Kevin Zingler, chair of the council, that the council submit the testimony to the Appropriations Committee in support of the DDS budget proposed by the governor. Is there do we want to do a motion on that like I think we have in the past? Does anyone want to make a motion to that effect?
So moved.
All right, there's a motion moved by Rick Rothstein. Is there a second?
Second.
Seconded by Adrian Benjamin. Is there further discussion on the motion that we should draft testimony and submit it on behalf of the council to the Appropriations Committee meeting next week?
I
I see
think,
Adrian's hand. Yep.
I think we should talk about, I don't know.
How we're going to do that.
What we're going to say.
Yes, no, and that was what I was pausing there for, looking for. Basically, is there any members of the council who would volunteer to draft that? And then also, what are the topics that we wanted to cover in that letter? Obviously, the budget and the overall sense of getting additional funding into the DDS system is critical for providers and individuals and families. And we're thankful that the budget has been spared DDS to some degree within the appropriation at this point. In terms of cuts, we've, as longtime council members know, we've seen other budgets where there's been 5-10% cuts to line items, if not more. So more funding is needed, but we're grateful that there isn't any large cuts as proposed.
Would there be a way to, Adrian Benjamin, would there be a way to highlight the nursing crisis? And I don't know how the decision is made to allocate how much money for nurses, but I have heard through the CEO where my daughter Hark, that DDS pretty much pays $60,000 for nurses, which, it isn't terrible, but that and I know we can't compete with a hospital, I'm not suggesting that, but that other agencies somewhat similar are paying $80,000, and that they've had interviews with nurses who said, well, but they're going to pay me $80,000 either, I don't know if it's DMIS or DCF, but that's a pretty significant problem if, and I don't know if that's up to the governor's budget or if that's really a separate issue, but that's been on my mind a lot because we are in trouble with nurses.
So if I can, yeah, there's a Hunger Games effect going on, right? There's a cornucopia of food in the center of the floor, and only the strongest is going to get the food and survive. And it's a horrible metaphor, but that is how it feels with our sister agencies and with our private sector and with the hospitals and with a number of healthcare jobs requiring nurses and insurance industries where people can work remotely and consult and still make good money. So we are trying to align those, and I know that's in the interest of the state, but the state, to my knowledge, is no longer competitive with the private sector. While we may be competitive for IDD nurses, folks in the DDS community, we are not competitive at the state level for nurses currently, based on what hospitals and insurance companies and other sectors are paying. And it's a problem, but it is one that the Governor's Workforce Council and Kellyanne, I think it's Kellyanne Valieres, is looking to address by it's a supply and demand issue. We need more nurses. So they're looking to see how they can train more nurses, increase the supply, decrease the demand, and lower, settle into a price. Although I never see wages dial back. I've never seen that where all of a sudden we're paying less for people that 3 years later than we are today. But nor do I think we should. I'm just saying. Adrian, it's a horrible problem. I appreciate you highlighting it. I don't have a solution, but I just wanted to acknowledge it's problematic. And anytime we post for a position, I talked earlier about the direct support workers that we need. Very often that has a vacuum effect on the private sector, which is also desperate for staff.
Mm-hmm.
We are less attractive than we used to be because of the different retirement benefits and health benefits that are now in place. So it doesn't have the same impact it used to. But
okay.
This is Kevin Zingler, Chair of the Council. Are there other members who wish to comment on? We have a motion on the floor, but are there other comments regarding the motion in terms of topics we should include in the letter? One of the things I was thinking of is obviously the staffing shortage. Obviously, funding is always an issue. The use of the ARPA funding, how can we innovate and invigorate the system? And then I think also we've heard in there that mental health is a big priority of the legislative session, not only for, I think, school children, but also I think for our population. There's a lot of folks who have been isolated for 2 years. And I think there's going to be a lot of additional supports that are going to be needed in the future because of those mental health issues that are going to maybe creep up in the future. So I think that could be something we could touch upon too, that we're concerned about how we're going to support folks coming back into the post-COVID world, if you will. So recovery phases. Other thoughts, other suggestions?
Kevin, I apologize. Joe Carvalho, Executive Secretary, DDS. There is that motion on the floor, and then there was a second question underneath that motion as to who might be interested in helping that letter.
Right.
So perhaps we wait, because I don't think the motion was even seconded. So we have the motion from Rick Rothstein. I think we're looking for a second right now. And once there's a second, maybe we can discuss that and maybe.
Yeah, I think Adrian did second that. So
thank you. That was my mistake. I'll add her now.
That's all right. So we have a motion on the floor. This is Kevin Zingler, Chair of the Council. We have a motion on the floor to draft a letter regarding the appropriations hearing next week. We have some topics that we've discussed. I guess to Joe's point, are there members of the council who wish to? We seem to work well when we all work together via email and then submit testimony to the council for review early next week before it's submitted. So are there a couple members of the council who would be willing to draft that testimony? I will help. Are there other members? Aaidd? Anyone else? I know Pam was on earlier. I'll ask her to help. Pam Donorama, she was on the phone. And then also Lisa Rowland was on the phone too, just for the record, Joe. She had texted me that she was on the phone. I don't know if you got that, so. All right, so
I think that leaving early automatically volunteers you for helping, Kevin.
Yeah, that's usually how it happens. So all right, so we have a motion on the floor. We have 3 members at this point, and if others are willing to help, please let me know, and more the merrier. And we have a couple topics: nursing, staffing, mental health, general funding, use of the additional ARP fundings. Is there any? I think that's pretty much enough we should fit into this letter, unless there are other suggestions. All right, so
good.
All in favor of the motion on the floor, so by saying aye.
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 Anyone opposed? Chair votes aye and it passes unanimously. We will submit testimony on behalf of the council next week. Excellent. Getting back to, I think, the legislative breakfast. Well, not the legislative breakfast, but go ahead, Kevin.
Yeah, just I forgot to mention one more thing because I'm assuming, Kevin Bronson, DDS. So I don't think I mentioned this, but the DDS budget presentation, the one that the commissioner's presenting at, is 10 o'clock in the morning on the 24th. It's 10 to 10:30 is our time slot. And the public hearing portion starts at 2 p.m. So
excellent.
I don't remember if I mentioned that or not. So people
Excellent.
want
No,
to follow along on CTN.
excellent. And I would assume, this is Kevin Zingler, Chair of the Council. I would assume, as done in the previous years, usually we get an email copy of the testimony the day of, or, you know, as it's being happened, right? So we'll have a copy of it, or we, in case people can't tune in to see it.
Kevin Bronson, I can happily do that.
Great. All right, perfect. That's just been tradition, I guess, just to let you know.
Yeah.
So,
And I just want to make it clear, I won't be reading that testimony, so you can watch. You'll see me introduce myself and a few staff, and then they actually, if I can avoid, they're so crunched for time in a short session and doing it remotely that we anticipate there being very little back and forth, and much more we will get back to you on that, just so they can get through because every legislator needs an opportunity to ask questions. And I think I have as Kevin said, it's a half an hour, and they are not letting you run over because they have them stacked. So it won't feel like maybe it has at other times where I, it has that kind of interchanges that typically I would, that may happen more so at the working session a couple weeks later, which will not be broadcast, I don't believe, or it traditionally has not.
okay.
Yeah, and Kevin, to that, Kevin Bronson, DDS. I've been watching other presentations come through, and a lot of it is legislators ask questions while the staff writes the questions down, and then we will get back to them in a written response. Just like you said, because it's a very, very short time, and as you know, they always will go over. So
Great. This is Kevin Zingler, Chair of the Council. Once again, just wanted to circle back on consensus by the group to invite the Senate leadership to either a future meeting or a special meeting of the council, properly noticed, of course. Is that consensus of this group here? I don't think we need a vote, but just want to make sure that we got that in on record, that we were looking to invite the Senate leadership to a special meeting or to a council meeting in the future here as part of the legislative session. Kevin.
Kevin Bronson, can I poll or can you poll as chair? Can you poll to find out if people would prefer a special meeting over the next, a standard next meeting in March? Because
sure.
The only reason why I'm asking that is it might be easier to work around the legislators' schedules rather than invite them to a standing meeting. But I'm happy to try both ways.
Okay, this is Kevin Zingler, Chair of the Council. Is there any concern about having a special meeting or a special session of the council? If you recall, that's what we did when we had Representative Candelora and Representative Rojas to make our lives and their lives easier in terms of scheduling purposes. I see a lot of head shaking. Is there anyone who feels that that is not a direction that the council should go? All right, hearing none, I think we have our answer, consensus that we can schedule a special meeting as needed, or if their schedule permits, they can attend one of our scheduled meetings, but we have flexibility.
And sorry, Kevin Bronson, one more question. Are you guys looking for the Senate President Pro Tem, Martin Looney, and the Majority Leader, Bob Duff? Or are you just looking for the majority and the minority leader, Kevin Kelly, Bob Duff? Like, I just want to know what you guys are looking for from me.
This is Kevin Zingler, Chair of the Council. I think at this point, with the legislative session coming up, I think we would get either. I think the council always wanted to make sure we wanted to have both representation, to be fair, across both aisles. So definitely a minority and majority representation. If Senator Pro Temp Looney wants to delegate that task to Senator Duff, that's his priority. But we'd be happy to have both individuals as long as we have minority and majority representation present. I see Karen has her hand up too.
Karen Levesque, yes, I agree that we traditionally have had representation from both majority parties when we have spoken with them, and I would think that that might be best.
Kevin Zingler, Chair of the Council. I saw Joe, you had a mic. your suggestion or thoughts?
So just touching base on the discussion of who we should have, just based on who we had last year, which was the majority and minority leader from the House. If we were to do the same this year, but for the Senate, it would be the majority leader of the Senate, meaning Bob Duff, and his counterpart on the other side. And forgive me, I'm not as familiar with who represents the other side. I think it changed more recently than Bob Duff was, as majority leader.
This is going to be confusing, but this is Kevin Bronson, and it's Senator Kevin Kelly.
Yep.
So with that, I just want to make sure, because I assume that because you didn't invite the speaker, which sounds like Martin Looney wouldn't be at that. But so I just want to make sure I'm inviting the correct people that the council would like.
This is Kevin Zingler, Chair of the Council. I think Joe was correct. So let's reach out to Senator Duff and Senator yes, the minority and the majority leaders of the Senate, and we'll leave it at that. Joe?
Joe Carvalho, DDS. The commissioner just messaged me saying that his teams just quit. So he wanted to just wish everyone a good night, and he apologized for leaving the meeting abruptly, but just wanted to put that on the record.
All right. So I think we have consensus to do that, and we will do so, and we'll get some dates out, and obviously it'll be via a virtual Teams meeting or Zoom call, probably Teams, because that's DDS supported. So we'll do that. And obviously we'll get some dates out and see what works best for the council and also for the Senate leaders, and we'll get back to you guys. All right, perfect. All right, so moving on, next item on the last item on our agenda is topics for future council meetings. So this is an opportunity for council members to express items or things that they would like to see the council address in the future at council meetings. Our next meeting is March 17th at 4:30 p.m. via Zoom, via Teams. So are there other topics right now? As of now, I have Katie Rock-Burns is going to talk about the Aaidd partnership. We're going to invite her to that meeting, pending her schedule, and then Dr. Ellis about the DEI work that she's doing with the department. Are there other things that council members would like to get reports back on or get updates on? All right. If you have any suggestions, I send out an email, so please respond back to that. And depending on availability of folks, we'll try to get folks there depending on what the request is. So with that, I will entertain a motion to adjourn at 5:59 p.m.
Karen Levesque, so moved.
So moved by Karen. Is there a second? Seconded by Patty. All in favor, signify by saying aye.
Aye.
Anyone opposed? Chair votes aye, and we are adjourned till March 17th at 4:30 p.m. Have a great night, everyone. Thank you. Take care.
Good all.
Good night, thank you.